All right, Dr. Vince here from Mountain Wellness Center. Welcome back. Today is the day where we're actually gonna go over your x-rays so you can actually see and understand for yourself exactly what's causing these issues. And by the way, the whole reason why we do this is because instead of you just trusting myself and Dr. Ryan, we prefer to actually see your x-rays and understand them for yourself so that it actually makes sense to you why you have the problems that you do. And then today we're also gonna go over the strategies to get this stuff healed up and corrected. But let's jump into some x-rays because I want you to have a little more information about what actually causes things like headaches, neck pain, pain in the upper back and shoulders, those chronic tight knots that never go away, radiation, numbness, tingling down in the arms, down your fingers. We want to talk about what actually causes this stuff. And so I think the easiest way to go over x-rays is this. I always like to put a healthy set of x-rays here, and I put your x-rays here to the right. So we actually have a side-by-side comparison view. And this helps a lot of people just really understand, okay, what's normal and then where am I at? Am I actually normal? And so here's the biggest thing we have to see when we look at the neck from the side position. Very simple, make it real easy. We need to see one thing, a nice big C-shaped curve. That curve needs to be 45 degrees, which just means your head is over the center of your body, just like that. And the reason why that matters is that your head weighs about 20 pounds. The weight of that head, it's gonna compress down on your neck as you go through life, that's inevitable. But the good news is your neck is built for that, it's designed for that, as long as the weight is in the right spot. And what I mean is to the right of this green line here, that's called the weight-bearing part of the joint. So just like in your home, we have a load-bearing wall, your spine has the same thing, it's built in. And when the weight is here, there's no pressure on nerves, on discs, you don't have headaches, you don't have neck pain, don't have shoulder pain, no numbness tingling, you feel good, and posture-wise, you look good as well. That also means problems only happen if you lose that curvature. If you lose the curve, this stuff compresses down. We don't actually feel pain in our spines unless we get compression. Compression is what causes all this stuff. So if you lose the curve, that compresses down. That's what causes things like arthritis and bone spurs and degeneration and all these words you've probably heard, but you may not actually understand what they are. Well, now we have some visuals so we can actually see what's going on. So let's go over here to this patient, for example. So the green line right here, this is exactly where we're supposed to be. This is nice big green curve. The red line is where this person is, and you see what's happening. They're losing that curve. It's actually going the opposite direction. And again, what happens is the weight shifts and it compresses these joints. That's what grows these big, huge, ugly bone spurs you have right there. And people ask me, why do I have these little razor blades growing out of my neck? It's because this person right here, they started losing that curve many, many years ago. Now, it doesn't mean that this person started 20 years ago with a 10 out of 10 pain level with their neck. This stuff starts with just a little ache or pain or stiffness. But unfortunately, if that's not properly corrected and we add time and gravity to the equation, this is what happens. And this is typically when most people make their appointment with us, when it's finally unbearable and people just have to reach out for help because they're so sick of suffering. So this is what we need to see in the x-rays. I'm gonna show you your specific x-rays so you can see where you're at and how you compare to this. Now, the big thing when it comes to the degeneration, the compression we talked about, there's 3 phases, phase 1, phase 2, and phase 3. Phase 3 is where the joints actually fuse together. And phase 3, once it's fused, that cannot be fixed. That is permanent pain, permanent nerve damage for the rest of your life. That's a very sad quality of life to be at. So there's nothing you can do for that. I mean, even surgery is a 10% success rate. It's not good odds. The good news is though, if we can catch you before you're in phase 3, we can make full recovery. I mean, 100% improvement on this. So your x-ray is gonna show us where we are on that timeline of degeneration and what can we actually accomplish with you, and can we make it perfect? Can we get you back here? And then how long that will actually take. So we're gonna go in depth with this on your appointment here in just a couple minutes, and can't wait to get you feeling better today.